Hello, my name is Dr. Alvarellos. I am the Psychiatric Director at KCS, Korean Community Services in Orange County. We will be going over some slides and go over a quick presentation regarding mental health awareness today. So why is mental health important? Mental health is involved in effective functioning in daily activities, resulting in productive activities such as work, school, or caregiving, healthy relationships, and an ability to adapt and cope with adversity. Mental health acts as a foundation for emotions, thinking, communication, learning, resilience, hope, and self-esteem. It acts as the key to relationships, personal and emotional well-being, and our ability to contribute to our community and society. Mental illness. It refers collectively to all diagnosable mental disorders involving significant changes in thinking, emotion, and/or behavior, distress and/or problems in functioning in social, work, or family activities. Some are mild and only interfere in limited ways with daily life, such as some phobias, some abnormal fears, or situational anxiety, but generally don't necessarily impact somebody's level of functioning. Other mental health conditions are so severe that a person may need care in a hospital. How common is mental illness? It's very common in the United States. Approximately 1 in 5 adults and adolescents live with a mental health disorder. Approximately half of all mental illnesses begin by age 14, and 3/4 begin by age 24. Suicide, which is often associated with mental illness, is the 10th leading cause of death in the US. It's the second leading cause of death among people ages 15 through 34. So what about the stigma of mental illness? Many people who have mental illness do not want to talk about it. However, mental illness is nothing to be ashamed of. It is a medical condition, just like heart disease or diabetes. Mental health conditions are treatable. However, people with symptoms may feel ashamed or embarrassed to seek diagnoses or treatment. Mental illness does not discriminate. It can affect anyone, regardless of your age, gender, geography, income, social status, race, ethnicity, religion, spirituality, sexual orientation, background, or other aspect of cultural identity. So what are some signs and symptoms of mental illness? Mental illness symptoms can affect emotions, thoughts, and behaviors. It's an inability to cope with daily problems of stress, trouble understanding and relating to situations and people, major changes in eating habits, changes in sex drive, excessive anger, hostility, or violence, feeling sad, feeling down, excessive fears or worries, or extreme feelings of guilt. What are some other signs? These can include withdrawal from friends and activities, significant tiredness, low energy, or problem sleeping, confused thinking or reduced ability to concentrate, detachment from reality, things like delusions, paranoia or hallucinations, problems with drug or alcohol use, suicidal thinking, extreme mood changes, including extreme highs or extreme lows, and alternating between those extreme highs and extreme lows. Sometimes symptoms of a mental health disorder appear as physical problems such as stomach pain, back pain, headaches, or other unexplained aches or pains. When to seek for help. If you have any signs or symptoms of a mental illness, see your primary care provider or a mental health professional. Your physician must evaluate these symptoms to confirm that they are due to a mental condition and not any physical condition or any other medical condition. Most diagnosed mental illnesses don't improve on their own, and if untreated, a mental illness may get worse over time or cause serious problems. What about suicidal thoughts? If you feel in danger of hurting yourself or attempting suicide, these are ways to get help right away. Call 911 or your local emergency number immediately. Contact the suicide hotline. In the United States, you can call or text 988 to reach the 988 Suicide and Crisis Lifeline. It's available 24 hours a day, 7 days a week, and services are free and confidential. Seek help from your primary care provider. Call your mental health specialist. Reach out to a close friend or a loved one. Contact a minister, a spiritual leader, or someone else in your faith or community. Suicidal thinking usually does not get better by itself, so you're going to want to get help. How do we diagnose mental illness? There are more than 200 different types of mental health disorders. A few of the most common types, and those that I'm sure many of you have heard of, include anxiety disorders, ADHD, autism spectrum disorder, depression, bipolar disorder, and other mood disorders, disruptive behavior disorders, eating disorders, OCD, obsessive compulsive disorders, personality disorders, including borderline personality disorders, antisocial personality disorders, among others, PTSD, post-traumatic stress disorder, schizophrenia, and other psychotic disorders, substance use disorders, including drug addiction and alcohol use disorder. A healthcare provider will carefully review your symptoms to evaluate your mental health. Be sure to tell your healthcare provider if there are any specific triggers that make your mental health worse, if your mental health problems are chronic or ongoing, or if they come and go, they're intermittent. When you first notice the changes in your mental health, those would be important things to let your primary care provider know. There aren't any medical tests that can diagnose mental illnesses, but your healthcare provider may perform tests such as blood work or imaging exams to rule out other conditions that can affect your mental health. It's important to get a diagnosis from a healthcare provider who specializes in behavioral health disorders. You need an accurate diagnosis to receive accurate and correct treatment. Treatments for mental health disorders include psychotherapy or talk therapy, medications, brain stimulation therapy, or other alternative therapies. So what is the take-home message for today? The take-home message includes that mental illness is very common in the United States. It's never too late to seek help. If you're suffering from a mental health condition, there are many different treatment options available to help you feel better. Schedule an appointment with your healthcare provider to discuss any concerns you have about your mental health. Reach out to us at KCS. We have clinics in Anaheim, Buena Park, Fullerton, Garden Grove, and Irvine. You can also reach us on the web at www.kcsinc.org. That's www.kcsinc.org. Thank you.